Welcome, and thank you for spending some of your time with us. My name is Tina Rosenquist, and this is Knowledge for Wellness. And this show is to better inform you, because the more information you have, the better decisions you can make. And knowledge is power. And today's topic is on effective treatment for pain relief. And bringing us this great information is Jan Hansen, and you are the owner of Advanced THEREX Rehab in Woodbury, Minnesota. Welcome, Jan.
Thank you for inviting me, Tina.
Wow, what a great concept, pain relief. Oh, there's so many people out there right now, and I don't think people are really aware that a physical therapist can actually alleviate some of their pain.
We have some new devices and some new treatment techniques now that have really been effective. And the use of them in our clinic has made a huge change in the effectiveness and the success we have with our patients.
Oh, that's so good to hear. But I'm not sure that you have been on Knowledge for Wellness before, but I'm not sure some of the viewers caught that show. So if you could just reiterate to my viewers, you know, your love, your passion, and why you decided to actually build this great corporation of THEREX Rehab.
Well, you know, there are so many people who have had their life changed because they have pain. They find that they're unable to do the things that they did before. They wonder if they'll ever be able to do that again. They wonder if they'll ever have a whole night's sleep again. They wonder if they can go to watch their grandchild play soccer and stand on the soccer field.
Sure.
They wonder, you know, if they'll be able to work and get through the day without a huge headache. So when I started my practice, I really wanted to address the issues that people have, those issues. And we have continually looked for ways to improve our treatment. And there are some new treatment strategies, as I mentioned, that really work.
Stay with me. Yeah, that's so great. But when I think of a physical therapist, of course, I think of when my mother had her hip replacements and, you know, working with a physical therapist on that end. So you are licensed, you are covered, but also what sets you apart with your THEREX Rehab than other physical therapies?
I think in our clinic, we look at some things that we find seem to make our treatment more effective. One is obviously what you do. And so what we find when we talk to our patients is they consistently say they appreciate the fact that we integrate our treatment, that we use many different techniques, the techniques that we think will work best for them. Two is we use a holistic integrated approach so that we don't separate out the hip from the knee from the foot. For example, if a muscle runs from your hip to your low back, would you call that? Would you just treat your low back? Would you just treat your hip? No, that wouldn't make sense. So we look at more of an integrated approach.
You look at the body as
a whole. And it's really important to do that because so often in healthcare we get stuck with that little piece. And treating the little piece is really, in my opinion, not very effective. So we hear that a lot from our patients, that they feel like that is a big difference. There are two emerging techniques that we use in our clinic that I think have been extremely helpful. And so those techniques are, one is called ETPS. It is the use of an electrical stim device. And this is the device. And we use this device. It has a little probe, and we use it on myofascial points, so we might use it on the muscle if the muscle is tense. We also might use it on acupuncture points. And so depending on what we're trying to treat, the therapist designs a protocol, uses multiple protocols to decide how we're going to use this device. This does not hurt. With this device, when we treat people, we don't have to use needles.
Okay.
So we can treat the acupuncture point with electricity.
Oh.
Okay. So if someone is afraid of needles, this is a great device.
Sure.
Another thing is that sometimes insurance will only cover a certain number of acupuncture point treatments. However, with this device, it's a standard physical therapy kind of treatment in the realm of electrical stimulation.
Oh.
So this is entirely covered by insurance.
Okay.
So that is the other neat thing about it. Now, when you go to the doctor, you usually go when you're accessing physical therapy, you have a problem. Very often it involves pain.
Yes.
Because you're going there because you hurt. You injured your shoulder in sports. You had an ACL tear. You're post-surgery and your knee is not working right. And so when you're dealing with pain, in our clinic, we try to keep all of our treatment pain-free.
Okay.
Because if you're going to your doctor because you have pain, you definitely don't want to go to your therapist and have them give you more pain.
Right.
What I found is that if we use a certain model where we look at improving the mobility at the joint, if we can, first, and then we restore the muscle function, that we can then get the person to moving better, quicker, without that person experiencing pain.
Right.
So this device, and the reason I'm still hanging on to it, is that we can actually treat a muscle that has a lot of tension in it, and I can feel the muscle relax.
Oh, okay.
What this does, it does many things, but one of the things it does is reset the muscle so that the muscle fires more normally. When the muscle fires more normally, then the normal length is restored. When the normal length is restored, then it produces enough force so that it can do what it should be doing.
Okay.
And very often when you have a dysfunctional muscle, it is not firing normally, not working normally, not producing enough force. Other muscles try to help it out, and then you end up with more tenderness in the muscles that are trying to help but really aren't supposed to be helping.
Okay.
So this device is great for helping that. It also increases endorphins, which affects pain. So all of those things really help decrease pain and get people moving into a more normal lifestyle. The second kind of treatment that I've introduced to our practice recently is called PRRT. It is primal, it's a mouthful, primal reflex release technique.
Okay.
And it is a gentle tapping on the body where we use the nervous system to, we actually use the reflexes in the body.
Oh, so you actually stimulate, yes.
We stimulate reflexes and we can get muscles to relax, areas or regions that were tender to not hurt.
Okay.
And so that is very quick and again gentle. We usually know right away whether either of these treatments is helping.
So you're saying perhaps maybe 1 or 2 treatments? You can see results right away?
We should know within 1 or 2 treatments if these devices are helping, so that the patient does not have to go through 12 or 15 treatments before they know whether that type of treatment is helping or not.
Okay. Wow. Well, this brings me back to a thought then, you know, because I'm so used to going to a physical therapist just after you've had surgery, or if something isn't working right or you want to relearn, someone needs to relearn how to walk. So if you could tell my viewers a little bit about, you know, what patients that you do see.
We see any kind of problem that involves pain. It can be acute pain or it can be chronic pain. It is very important to try to address people initially with acute pain so that it does not become chronic and so that we don't have secondary problems. The type